In the treatment of PV, we also have a probably interesting drug that is Rusfertide, which is indeed a drug that may allow to get rid of phlebotomy in the patients with polycythemia vera by acting on the hepcidin pathway. So there's an ongoing study that will start soon in Europe also, testing its ability to reduce the need for phlebotomy or replace phlebotomies in these patients without inducing iron deficiency, which is often a side effect of repeated phlebotomy that also induces a lot of symptoms for our patients. Also, in essential thrombocythemia, we didn't have so many new drugs for many years now, and we have Bomedemstat, which is a new agent that has shown a very huge efficacy in early phase studies with almost all patients virtually responding to this drug by reducing the platelet level below 400,000. So again, we wait for the phase 3 trial to confirm these findings, but this could be also a clear improvement for patients with ET who don't have so many drugs that are able to reduce their platelet level and avoid vascular complications.